One reason why many fertility seeking couple stop to take fertility treatments or hesitate to take fertility treatments cost, especially when it comes to advanced treatments like IVF, ICSI, what is called as test tube baby techniques, right? So I'm Dr. Archana S. Sayanathan from Dr. Archana IVF, Chennai. So IVF ICSI was considered to be the very expensive treatment when it comes to advanced fertility treatments. So this was some 20 years ago when they said that only well-to-do patients can take such treatments. Poor people cannot take such treatments. So when it comes to advanced treatments, there are a lot of cost involved. So today I'm going to talk about what is the cost involved and how much is the cost you can expect, because 20 years earlier the cost was completely different. Now it is in such a way that everybody is accessible and can definitely afford a IVF treatment. So when it comes to IVF treatment, there are things which are going to be very constant for each couple. Okay, and there are things which is going to be variable depending from patient to patient. Certain cost might increase. So let me talk about the constant things what the couple have to do and what is the constant cost involved in IVF treatments. So basically there will be an initial evaluation for the couple. So what do we do in the initial evaluation? We evaluate the general health of the lady and the general health of the husband. That is done by the blood test, where that includes even the reproductive hormones. After that we do a general screening ultrasound for the lady. So with these basic investigations we will come to know what is the problem and how you are going to get the treatment. So this cost is going to be somewhere around 5,000 to 10,000 rupees depending upon the center to center. So after this comes the IVF procedure cost. So when I say IVF procedure cost, what is the cost I am talking about? The cost is for the ICSI procedure or the IVF procedure what we do inside the IVF lab. So once the couple decides for an IVF treatment, the next step is going to be injections. That is the daily injections what we are going to give for the going to become mother, right? So this injection is like earlier 20 years back, we used to get all these injections from a foreign country, because these injections are basically produced from human menopausal urine. That is, we take the urine from a menopausal lady, separate the FSH and LH hormone, and then we purify it and start using it for the women. So such injections are coming from foreign countries, so the cost is going to be really high, and initially the cost was very high. But nowadays all these injections are made in our own country itself, so the availability of the medicines are more, and the quality of the medicine is more, the purification system is also more. Even now we have these recombinant injections also, where we isolate the genetic, the DNA pattern of the human menopausal urine obtained FSH and LH, and we design a recombinant DNA and we multiply it vial to vial. Safety, efficacy, purity and availability of the medicine is same, and in that case recombinant injections are more efficient when we give for the lady. So these recombinant injections are also available in our country itself and is getting produced in our country itself. So the availability of the medicine is more, the cost is also coming down, isn't it? So the cost of the injections also has come down to a greater extent compared to the last 20 years. So the when I say cost, it's going to be approximately every day for the upcoming 10 to 12 days the lady will receive injection. So the cost of injection, a major chunk of whatever the treatment cost is going to be. The third step comes the egg retrieval and mixing of the husband's sperm with the egg, or injecting of the husband's sperm with the egg. That is the IVF or the ICSI procedure. So that procedure involves giving anesthesia to the wife, taking the eggs out, and using the egg and the husband's sperm. You either mix it inside a petri dish, put it inside your incubator, that is called IVF, and you take the egg, inject the sperm inside the egg and make an embryo, that is called ICSI. So two different techniques, right? So both the techniques involves availability of a complete lab setup. For IVF just an incubator is enough, but to do an ICSI we need these micro manipulators and trained people to do a micro manipulation and inject the sperm inside the egg. After doing IVF and ICSI, there is a procedure called day 5 culture, day 3 culture, that is growing this embryo or the baby for 5 days. That also needs special expertise and special instruments. So So the entire procedure of IVF ICSI is such a tedious procedure that not many people understand the effort given by the medical team for this. So this involves a cost. So this is the third part of the cost. And the fourth part of the cost is the embryo transfer, where the embryo which is made is going to be kept inside the mother's womb. So for the embryo transfer, again we will have certain things to do for the lady. We have to prepare her endometrium, and then the embryo transfer has to be done. So last cost is going to be the embryo transfer medications. That is, after embryo transfer, what are the medications I am going to give, and these medications are going to be the supportive medicines what is going to take care of the baby. Because for example, if you are doing a frozen embryo transfer, which is very popular nowadays and which is very well known for the success rates, a frozen embryo transfer, in a frozen embryo transfer, the mother does not supply any kind of progesterone from her body. It is entirely dependent upon the progesterone hormone which I give. So the medications are very important, and it depends from patient to patient also. So the first 6 to 12 weeks the medications are also a part of the cost. So approximately all put together, as I told you, there are about 4 to 5 steps, right? All put together, the general basic cost of an IVF treatment would be somewhere between 1.5 to 2 lakh is the cost what we are expecting. But if somebody is telling you that you can get it done in 40,000, or if you can get it done in something very less, no, it is something not true. Maybe they are not doing the advanced treatment, they are doing something else for you. But if you are seeking an advanced treatment, please be aware that this is the cost involved. You will definitely have to be prepared for this, and try to choose the right center, because just making an egg and sperm, taking it, fertilizing it, making an embryo, putting it inside the mother's womb is not going to help you get pregnant. That anyone and everyone can do. That is what is happening nowadays, that with the upcoming or mushrooming of so many centers in our country and outside countries also, there is mushrooming of so many centers. There are places where the egg stimulation or the ovarian stimulation is done elsewhere, and the patient is sent elsewhere for to another hospital for the egg collection, to another hospital for the other processes, for the scanning and all. But by doing such things, somewhere there is a lag in the treatment for the patient. So choose the center wisely. Just make sure that all the treatment process is done by the same doctor under the same roof, and all your fertility problems are getting solved in the same center. So that is how you should choose your center. And again, I'm telling you, it is not just the egg and the sperm and the embryo. There are other factors also. You cannot just make an embryo, make a blastocyst, transfer into the mother's womb and expect the lady to get pregnant. There is the general health of the lady. Sometimes there might be a history that she might have had some abortions, she might have had an IVF failure also. So blindly repeating the treatment is not going to make you conceive. There should be an evaluation which has to be done to the couple. Patient based protocol should be there, and if any other advanced techniques or if any other advanced treatments or investigations is required per couple, that will be advised by the doctor, and that will be an extra treatment cost for you. But general treatment cost is the one which I had told you earlier. Please be prepared for your treatment cycles, because this is going to be definitely physically and emotionally stressful treatment. But if money is going to come in between, and if you are not planned with your financials, this physical and emotional stress what the treatment is going to give you is going to slightly increase. So be prepared for your treatment so that your emotional stress comes down and your treatment becomes a successful procedure.